welcome to our latest event, An Interviewer's Perspective. So today we have two amazing presenters for you, Dr. Thea and Dr. Abbas, and they're both F2 doctors who are currently in their pediatric block. And if you want to find out more about our initiative, you can visit our website, www.In2MedSchool.com, or you can check our social media pages on LinkedIn, Instagram, and Facebook. So who are we and what do we do? We consist of more than 1,600 student mentors from various universities across the UK, and we offer free mentoring services to disadvantaged Year 12 and Year 13 prospective medical students. The main aim is to offer one-on-one mentoring sessions, online webinars, and many educational resources to nail your medical school application. And so now, without further ado, there's one more slide. So can we just follow these webinar etiquettes? And it's the same as every single webinar that we have. Appropriate usage of the chat and the Q&A function, and we will be monitoring it. Any inappropriate comments will be deleted and you will be removed from the webinar, so please be professional. Use the Q&A function if you have any questions, and we will answer all the questions at the end of the webinar. This webinar will be recorded and will be available to be viewed at a later date. The link that we will send out to you that guides you to the Google Drive will have the slides and the recording of this webinar. Okay, and now I will pass on to our speakers.
Thanks, Shams. Hi everyone, I'm Thea and I'm one of the doctors who'll be leading the session today. It's really nice to see so many of you come to one of our webinars. I hope you really find it useful and most importantly that you come away feeling a lot more confident about any potential interviews that you've got. So the aims of this webinar is to understand who's interviewing you, most importantly to know what qualities they're looking for and why they're looking for those qualities. We'll hopefully give you some tips to show how best to show those qualities in an interview, and to reiterate, to have some confidence at the end, because interviews are not as scary as they seem, hopefully. So some of you might know, some of you might not know, but it's a real wide range of people that do medical school interviews. I think there's a common misconception that you go into your interviews and you'll be met with a panel of the board of directors, like the dean, the sub-dean, and some consultants, but it's really not true. There's quite often medical school faculty, and that's normally from the admissions team. They recruit lots of doctors. We've just had an email out recently trying to recruit more doctors for the virtual MMIs that are happening this year, which will be interesting because obviously not done any virtual medical school interviews as of yet. Quite often there's lots of other healthcare professionals from the MDT, and MDT stands for multidisciplinary team, and it basically just means all the different specialties that come together to look after patients. They're keen to recruit medical students because obviously they've been through the process more recently, and obviously they know, what's involved at medical school at the moment and who's going to be most suited to study in that way. And yeah, so people from the admissions admin team, not necessarily medical professionals, but people who do this year in, year out. So a really wide range of people that you will be questioned by.
So, hi everyone, I'm Abbas. I'm an FY2 doctor in pediatrics. I went to University of Leeds. My interview was about 7 years ago, but I remember how that sort of time was, and of course the uncertainty related to it, and generally sort of the nerves and preparing for interviews. I'm wishing you all the best with this, and we hope that today helps you gain, as Thea said, a lot of confidence, because they just want to see the best that you're going to bring, and I'm sure you're all going to bring the best. So we've been part of the interview panel before. As Thea's mentioned, there's quite a few different variety of people, and just thought I'd mention that actually you get to know a little bit about what sort of training we get as well, just so it makes you feel a bit more comfortable. So generally people who are interviewing you are given generic training, so they learn to sort of provide open questions initially, and then kind of narrow it down. Normally you'll have, in an MMI situation, you'll have one sort of stem or a question if it's asking you about yourself or how you'd react in certain situation. And after you give us yours as a spiel, as you'd say, we narrow it down and ask for the specifics, because we want you to do the best, and that moves on to the providing prompts. you might feel that there'll be moments where your interviewer is, really prodding at you with quite a few questions, but actually don't take that as a bad sign. Sometimes they want you to get more marks. Sometimes they want you to really talk about the qualities that you've mentioned in a bit more detail because they're actually very interested in those aspects of yourself. We also taught about our nonverbal cues in our interview sessions. We are taught that our body language, can kind of make interviewees feel a bit scared, maybe. Generally how we position ourselves in the station as well. If there's another member of staff who's such as an actor, for instance, even their etiquette as well, while they're being the actor in the station as well, is standardized. So hopefully that gives you some level of reassurance. Specific things about the MMI, normally we tend to do the same station throughout the day. So that way we're kind of having a level of continuity. There are little sheets that we refer to as well, which tell us what sort of things to highlight and get marks off of when we hear them from candidates. And as much as most universities, at least I know at Leeds, have certain criteria, reassurance is that there's also a global score about your general performance in the station, which accounts for anything else that you mentioned, which we might think as examiners is a great thing to mention in that situation. But we'll go on to specific stations as we move along in terms of sort of themes that they cover. Just general sort of questions people tend to ask, and this is just a minimal list. There can be a wide variety of things that they can ask in the interview. I'm sure you all have probably prepared for at least maybe one of these or two of these. The first being, why do you want to be a doctor? I mean, that should be rolling off your tongue because you're all here. You all want to be, hopefully, doctors and great doctors. What do you think the challenges would be? What qualities? I think the third question, why do you think you'll be a good doctor, is looking at the qualities that will make you stand out and be suitable for the profession. Then we look at some questions, look at sort of your work experience, the things you mentioned in the personal statement that we want to know a bit more about. I know for one that I was asked about my sort of work experience in my med school interview. We also look at aspects, I guess, where you've had been challenged or maybe you made a mistake and how that made you feel and how that developed you as a person. So, when you've been under pressure or multiple deadlines, and not, it doesn't necessarily have to come from like a medical experience. It can be anything in your life, really. Teamwork, questions related to the news, NHS services being privatized, and also just looking at your general knowledge and also your general attitude towards things like empathy and sympathy in that case, but a lot of other aspects that make a good doctor. And Thea's going to move on to why they ask these sort of questions.
So I know in previous webinars that In2MedSchool have run, they've gone into loads of detail about different MMI stations, different questions to be asked at interview. That's not the sort of approach that we're going to take with this webinar. We're going to have some example stations, don't get me wrong, but I think the main focus is the qualities that we're trained to look for as interviewers, and why we're looking for those qualities, and how you can show these qualities in stations, and what exactly it is that we're looking for with each set of skills. So the basis that we work off of, and I'm sure that some of you will have, if not read, you will have seen this document. It's the General Medical Council's Good Medical Practice. And basically, it's a document that lays out what makes a good doctor. It's split into 4 sections, which describe the professional values, behaviours, attributes of a good doctor and what they would expect from any doctor registered with the General Medical Council. I'm not suggesting that you go and read this book from cover to cover. It's a bit dry, it's in bullet point form, but this is what we're looking for. Essentially, you're constantly examined against this documentation throughout medical school, and then after you graduate you're constantly examined against it as a doctor as well. So obviously if that's what they want from the medical students and that's what they want from doctors, it would be sensible to be looking for those attributes and those qualities in potential candidates and applicants. So what we're going to do, we're not going to go through absolutely everything in this document, but hopefully you'll get a better idea when we go through the 4 different sections. that maybe you won't necessarily have to go and read this in any great detail, because you should get the majority of it from this talk. So we're going to go through each theme and sort of describe the theme, think about how it could be assessed in an interview, and then say what specific things exactly we'd look for revolving around that theme. Now, it's a bit of a disclaimer here. We're not going to be describing any stations in any great detail. We're not going to be, saying, or this station at X medical school or this station at X medical school. This is a very generic talk, and we might use some anecdotes to describe certain things, but we are not describing any specific medical school interview here. We're just going to go through some examples. Okay. Oh, sorry. So going back to theme one. So theme one is knowledge, skills, and performance. So the sub-themes in this is applying knowledge and experience and recording clearly, legibly, and accurately. So how might this be assessed? Now, applying your knowledge and your experience is something that they'll test thoroughly in your medical school interview. And the best way that you can show us that you've applied your knowledge and experience is reflections. And I know that in your previous webinars, they've gone through some reflective practice, but this is just stressing that reflections form a massive part of your assessment at medical school. And also as a doctor, Abbas will back me up on this, our portfolios are reflection heavy. You've got to be a good reflective practitioner if you want to be a doctor. And then on the next slide, I'll go through some sort of pointers on how to make good, well-rounded reflections. But if you think about some work experience you've done, maybe a piece of literature you've read, or an element of your personal statement, it would be really, really useful for you to prepare some reflections, reflective thoughts about a couple of these things before you go to med school, before you go to your interviews, because they're quite difficult to think of on the spot. And the whole point about reflection is it takes time to think and reflect. So I would strongly suggest that you take any one of these suggestions and think about doing some reflective work that you can whack out at your interview. Okay. Another thing that another way that this attribute can be assessed is doing, for example, ethics questions. I'm not going to go through lots of detail because I know that they've gone through lots of detail in previous webinars, and it's something that there's a whole wealth of information on the internet. But knowing your 4 pillars of ethics and common ethics themes like euthanasia, abortion, private practice, because that's a good way for us to assess that you have gained some knowledge that's not necessarily medical, because we're not expecting you to be doctors, we're not expecting you to be medical students, we're expecting you to think in a way that a medical student might think, and asking questions about ethics themes is a good way to assess this. So the second sub-theme, recording clearly, legibly, and accurately. So stations working through problems, obviously showing your workings is really important. Planning before attempting. No one is going to penalise you for taking 15, 20 seconds to actually think about the problem that you've been presented with. A really common pitfall in medical school interviews is, you're obviously especially with MMIs, is you've got a really short time frame, so 7-8 minutes. You want to get to the crux of the matter really quickly, but you dive in, you miss the point. It's something that happens all the time. If you take 15 seconds at the start to properly think and plan before you attempt a problem or a question, then that will stand you in really good stead. Data interpretation and calculation stations, again, same thing. Essay stations, it sounds a bit mean, but thinking back to my medical school interview, which was, probably 8 years ago now, I vividly remember having a station which was an essay station, which you think, how can I write an essay in 7 minutes? And I remember going into my station and seeing the person before me leave and then reset the station. And they'd written 2 sides of A4 in 7 minutes. And I thought, oh gosh, God, how am I going to write this essay? I sat down, had a mind blank, and ended up bullet pointing a framework, so an essay plan essentially, and I didn't write a single word, I didn't write a single sentence of an essay. It was just a plan, it was just a bullet pointed thing, and I got really good feedback on that station because it shows a more structured way of thinking. So just because you go into a station, you know, not necessarily for essay stations, but just because you go into a station, don't come out with a polished final product. Don't think that that means you failed that station. Okay, it might not. So what are we looking for? What are we assessing? Knowing your personal statement inside and out. Obviously, you've written it, you'll know it inside and out, but thinking about examples and anecdotes is really important. Your personal statement is a very short snippet, and what the medical school interview will do is delve into that. We want depth, and depth is the most important thing, which we'll come back to about depth, not breadth. So thinking about the point reflections, sorry, I should have referenced this. This is actually taken from our doctor portfolio about how to write good reflective pieces. So this is from the powers that be. So it provides like good prompts for you to think about how you can reflect on your personal statement and experiences. So what we want to see is, you know, what have you learned about yourself or your knowledge or your skills? How has it changed your perspective, and how are you going to apply what you've learned? And that application is really important, because we want to see that you've learned and you've grown from the experiences that you've had. So that's quite a good little framework if you want to, you know, look at your personal statement after this webinar and think, right, I'm going to select 2 or 3 different things that I've spoken about, and I'm going to reflect on those things. So those are quite good prompt questions for you. Make use of the resources given to you. This is another common pitfall. Quite often they'll give you lots and lots of things for you to use, and you don't use all of them, or you don't look through all of them before you start. You like to be gung-ho, and that's good, we like that, but thinking about using all of the resources that they give you is really important. Clear processing, so just reiterating what I said in the slide before, showing your workings, and whether that's on paper or whether that's talking through your workings, it's really helpful for us if you speak out loud to let us know how you've got to the conclusion that you've got to. And the last bit is, you know, we want to know more about you through your experiences rather than a list of your achievements. It's much more impressive to an interviewer for you to talk in depth about one specific thing, and for you to give lots of good reflection and good detail about one thing. It's great, you know, that you've managed to fit X, Y, Z into this year, but reeling off a list of your achievements is not impressive. You know, thinking critically and reflecting on 1 or 2 things is much more impressive to us than reeling off a list of achievements. Okay. Sorry, Abbas.
Well, moving on to theme 2. So safety and quality, 2 words that you will never stop hearing again throughout med school, throughout your life as a doctor. Ultimate priority is always the safety of your patients, and knowing when to respond to risk, or recognizing risk as well. And do this day in, day out, essentially. So how these can be assessed. Things can you can be given a scenario, or you can be given a station where you have to kind of explain yourself, or you might be given prioritization stations, and we'll kind of give an example of that towards the end as well. Knowing when you're out of your competence is where the escalation kind of comes from. And I think there might be a station where, you know, you have to sort of talk about how you'd have to maybe consult someone more senior, or consult, it might not be medical, it might be a security related issue, it might be ethics, as Thea mentioned, when you would step up and say, actually, this is wrong, I would do this. And that can tie into a prioritization station as well. Normally, prioritization stations involve a scenario, and there will be a barn door obvious choice that is clearly unsafe or clearly wrong, which you will be able to recognize. And there will be several choices that are less safe, or, you know, likely to result in risk. And then there'll be choices that seem more reliable, seem actually things a doctor would do, or someone who has, you know, demonstrated qualities of a doctor would choose. And again, this might not be in healthcare settings, so it could be, you know, a friend who's cheated on a test. How are you going to escalate it? You know, how would you go about supporting all parties? Would you, you know, tell your friend, what what level would you take? Would you go straight to a senior, or would you want to speak to them directly first, and then proceed to speaking to a senior? And I think that ties into a lot of knowledge about sort of the ethics and healthcare law as well. You might be given quite a tricky scenario, and you have to say, oh, do you support, for instance, I can give an example of, let's say, bariatric surgery, and you want to promote health. Would you just say everyone deserves it, or do people have to show initiative? And the general thing there is, so long as you say how you justify your answer, that's the sort of stuff the interviewer is looking for. If you are able to justify why your answer seems safe, practical, and right, you will get the marks. You will do well in the station. Don't feel like there's a golden answer in those stations. It's about how you are able to critically analyze the situation and tell us how you truly feel you would approach a situation, and whether we see the qualities of a doctor in your response, as well as your method of thinking in that sense. So moving on, and I feel like I've kind of touched on these aspects already. So safe decision-making process, again, I'll reiterate, there'll be a bond or obvious thing that is unsafe in most prioritization stations. If not unsafe, it'll probably be the most unjust thing to do. And knowing your limits and your competence, and asking to know, asking that I will ask for help in this situation. Because as examiners, we might see what you say as an answer to a prioritization station, and we'll be like, do you have anything to add? And I guess you could say that, if the scenario allows, I would, ask for a second opinion, or ask for an opinion with someone who has more experience. And then moving on to theme 3. And this is one that you will have assessed throughout your whole interview: communication, partnership, and teamwork. Communication is like the basis of the whole interview, essentially. And there will be stations which assess how, you worked in a team, or you've been in a situation where it's been tough to be a leader, quite common themes, and establishing sort of and maintaining relationships and partnerships with patients. So those can be assessed in a variety of ways. And that's the whole beauty of an MMI, actually, because as much as it's a stressful environment and you're moving from a station to a station to a station, the whole point of the MMI is for us to see, how are you able to communicate in a variety of settings? You could go on from talking about your work experience to, speaking to a simulated patient scenario or a simulated friend scenario, where you have to provide information about a certain situation, or you have to convince them to do something, or, have to listen to them actively and reiterate their concerns. And those are all sort of active listening, responding in an appropriate manner, to being able to talk about yourself with confidence and reflecting on it, and using the right sort of language in terms of verbal, and then also using non-verbal cues when, eye contact with your examiner, smiling when you enter a station. These are all things that we look for and actually appreciate, because we're like, actually, this person would be already creating warmth in a room if they were going to see a patient. A smile on your face, as much as COVID makes it a lot harder with our masks on, smiling when you enter a patient's room really changes the environment, and also the situation they're in. So you may feel the pressure on the day, but as examiners and as the setup of the interview, we want to see you flourish in a variety of settings with your communication. And there are some simulated patient examples there. So imparting information could be about a certain procedure that a patient's about to have. We wouldn't be asking you to talk about something absolutely beyond your scope of knowledge entirely. We wouldn't be talking about this particular type of surgery, for instance. But you may have well read around certain things, and there will be common themes that you'd be able to sort of help someone understand. Or alternatively, you will be provided information in the station, and you'll have to sort of go through the succinct points and be able to sort of in lay terms explain it to a friend or family member. And it's just about your ability to sort of analyze the information in front of you and communicate it in a very simple manner, because it's what we do on a day-to-day basis as doctors as well. And there might be situations which deal with emotions and demonstrate your empathy. You might have an angry person, you might have someone who you have to console, you might have a scared person, they might be scared of going for a certain procedure or scared of doing a certain activity. And it's just about your ability to just show emotion as well. So if anything, you should feel comfortable that you're being tested in a variety of situations. And while we're on that point, I just want to say that there is this tendency of coming out of the station and feeling so overwhelmed by how something you might have done went wrong. But I would say that you just want to keep your head clear after you finish that station, because you'd be surprised what examiners actually pick up on. And we don't tend to, at least from my experience, I don't tend to focus on all just the negative aspects. I want to see what the positive aspect was and what you're trying to achieve, and sort of be able to take that back and mark you up for that. That's how I would approach it. Of course, if they're striking negatives, then those get noted down. So people want to see you do well. Don't forget that. And team working in general it can be assessed. You might be asked, what work experience have you had where have you dealt with different teams? Tell me a bit more about that. Did you feel out of your depth? Did you feel, as a leader, for instance, what the challenges that you faced and things like that. And moving on to sort of key points here is so evidence of active listening, as I mentioned, respect and dignity, and that ties in with also sort of the scared, angry, or emotion-full stations where you have to demonstrate that. If you demonstrate respect and dignity, it's simple. It's just about being a good person, isn't it? Maintaining confidentiality is a quite a big deal, I guess. If we notice that goes off in your there will be like, they're not trying to trick you up, but you'd be like, if a friend has done something and you speak to them, and then you, in a prioritization manner, I'd move on to a different sort of way that they would test you. You just quickly suggest, no, I'm going to speak to another friend about it first before I speak to them. I guess we're like, okay, we might prod you and be like, do you think that would be nice for your friend to find out that you spoke to another friend about it before that you spoke to them? So we will try and save you in a certain way, maybe. Honest responses are the best. If you don't fully understand something as well, if you communicate in the station, actually, I'm not sure what I'm expected of from the station from the start, people are not going to mark you down. In fact, it will help you do better in the station. And honest responses to your experiences as well. Don't try and sugarcoat your experiences to a level where you think this is what we want to hear. It can be quite surprising, and I guess you can have a tendency to think that the interviewer is tricking you up and saying, oh, no, he wants to hear about this. No, I actually really want to know what makes you special and what makes you the right candidate to be a doctor eventually. And we've covered working collaboratively with the team and the composure. Just keeping your composure is so key on the day. Just if a station doesn't go well, just put it behind you. You have another few to go, and you just have to work to doing the best in each one. And when it's over, you have to tell yourself you did the best you can, and that's how you will feel. But if you let one carry you forward through and it's gone badly, you will end up causing that domino effect on them. So try and just remember, as soon as you come out of the station, forget about it, move on to the next one with a clear head.
Okay, so coming to the last theme, maintaining trust. So showing respect for patients, acting with honesty and integrity. So this is going to cover similar themes to what Abbas has already spoken about, especially with regards to the simulated patient stations, personal statement, quizzing, being honest. Most of the time interviewers are pretty good at picking up where things have been elaborated or in some cases fabricated. I mean, you know, people do all sorts to embellish their personal statements or experiences. Just don't do it. Please don't do it. It's really not a good move, and more often than not, interviewers will catch on. Okay. And again, prioritization stations, thinking about patient safety first, or thinking about the safest option, because obviously not necessarily in a healthcare scenario. We've got prioritization station example in a bit, which is in a healthcare scenario. Sorry, just on autopilot, I've written one in healthcare, but there, you know, potentially could be in, you know, in a supermarket or literally anything. They can put anything in there with a prioritization station. But in terms of how we're assessing your safety, your quality, things like that, appropriate use of empathy and sympathy. One thing that I'd like to point out here is that a common pitfall with empathizing with patients, especially in a simulated patient scenario, is people saying, I know exactly how you feel, trying to show empathy with the patient. You don't know exactly how that patient is feeling, because you've not had the same experiences, you've not gone through the same thing. So actually I would avoid, I know trying to show empathy is difficult, because, you know, autopilot, you would often say, oh, I know how you feel, I know how you feel. But sometimes simulated patients will turn around and snap and say, you absolutely don't know how I feel because you're not me, etc., etc. So I would avoid saying that. So I know you want to show empathy, but it's tricky. It's really tricky to do sincerely. So you know, you can think about the difference between empathy and sympathy, but more often than not, you're going to try and be sympathetic towards your patients, because it's very difficult to show true empathy, especially if you're in a simulated patient scenario. Okay, so that's just a little tip about simulated patients. So explaining to patients, again, I think it's something that Abbas has sort of already covered, but thinking about maintaining that trust and building that relationship and rapport. Admitting when mistakes have been made and apologizing for them. This is a bit of a mean question or scenario to apologize, because it takes a lot of skill. It takes a lot of skill to do it properly, but it's obviously really important to admit when mistakes are made and apologize for them. So that's something that makes a good doctor, and potentially could be something that we might ask you to do. And again, non-verbal communication, especially when you're interacting with a patient or an examiner, if you're trying to explain or do a simulated patient scenario. Okay. So what makes people really stand out? And I know that Abbas and I have had a discussion about this before, where there sometimes is candidates that you remember like years down the line. That sounds a bit sad, doesn't it? But you remember specific candidates for things that they say or the way that they came across. And so here it's just a random assortment of things that we think make candidates stand out. So knowledge of the course in university obviously is something that we would kind of expect, but going above and beyond to make contact with someone who's at the university, maybe finding something that is going on specifically at the time, any research things or things that the medical school prides itself on, to drop in at your interview is always going to be helpful. Confidence, not arrogance. It's a really fine line to tread. I think the best way to think about it is confident candidates come across as being self-assured, offering very open, honest, concise responses, whereas arrogant candidates act like they've already got an offer. So I would suggest, like, you don't act like you've already got an offer. But I know it's a difficult balance to strike, is when you want to come across as confident, not arrogant. But I think that's quite good. Candidates that have a personal approach, that aren't robotic. I know that you're going to be thinking about those typical interview questions that we said earlier on in the webinar, and you're going to be preparing answers. Everybody does. You might, recite some answers in the mirror or something, but when you're in the interview, yes, it's good to be prepared, but a way to make it seem like you're not being robotic is potentially to This may be a bit easier if you're doing a panel interview, because you can think back to some other questions or other things that you've spoken about before. It's a little bit more tricky in an MMI situation. But if you think about something that you've discussed before, so for example, something about the course, and you can feed that answer or put like a little snippet of that answer and bring it back into one of the questions or one of the responses you've already prepared, then that makes it seem a little bit more fluid, a little bit more off the cuff. So you can tell us all of the things that you've prepared, but if you mention something that an interviewer has said earlier on, one, it shows you're listening, and two, it makes it seem a little bit less robotic.
Yeah, I think on that sort of point in particular, when I prepared for mine a while back, but what I tended to do was certain questions or certain themes that, like, there's loads of books as well out there about interview questions, but try and do some questions where you've not prepared and see how you perform. Because in an MMI situation, there can be a tendency to think you've got a script for everything, and there will be points where, as Thea says, you will be able to bring in aspects of things you have learned and rehearsed and kind of know really well. But if you do improv stations, essentially, is what I'm suggesting, where if you have things that you haven't yet covered or themes that you've not looked at, see how you perform just out of the blue based on your intuition. And you'll be surprised how much you can put in from what you already know, but also how it will not take you as a back when you're actually in the MMI, because you will be also confident in being able to be challenged a little bit. Because the thing is that all examiners know that everyone who comes to med school interviews will have, to an extent, rehearsed some level of questions. And we want to take you out of that. We want to see you in your natural sort of setting, in a sense, but also what makes you a strong candidate. So preparing for not preparing as such is not a bad approach. So put yourself in hard situations now, and do like improv stations as well, so you recognize where you kind of have your pitfalls and where you're actually really strong, and then work on your pitfalls and enhance those strengths. Because I think there is a tendency to want to prepare for all the questions, and taking it to med school as well, there's a tendency to prepare for your exams fully. But what the MMI does quite well is it actually prepares you for your med school exams quite well, because we have practical exams where even after we're doctors, where we get thrown into scenarios we're not even expecting, and at work. So really challenge yourself with maybe trying to do stations that you've not prepared for. Okay.
Yeah, I think that's a really good point. Thanks, Abbas. It's a tricky one to do, but maybe if you can get a relative or a friend to do a bit of Googling, there's question banks galore out there, isn't there, for rehearsing or practicing for medical school interviews. So some of the things that, again, make people stand out. We've covered these points in slides before about, checking for understanding from patients, admitting when you don't know, asking for clarification. But it does, just because you don't know how to answer a question doesn't make you a poor candidate. Admitting when you don't know or asking for help makes you a better candidate. Okay. What we want is genuine answers backed up by good specific examples, keeping it nice and specific, and we'll go through some examples to sort of tie everything together and sort of put this into practice. But yeah, just reiterating again, one thing that you've gained is better than a list of 5 things reeled off. What you've got to remember is that interviewers will see, God, I don't know, 50 candidates over the course of a certain number of days, and all of them will have done some work experience, or they'll be in a sports team, or they'll do some sort of leadership role. You've all got really good stuff on your personal statements that you should be really proud of, and I know that you want to get it all in there, but trying to get some really poignant, meaningful responses or things that you've learned is much better than listing everything off. But well done for all of the things that you've got.
I guess while we're there, like in terms of like one thing, I'll give an example from my experience. When I was asked about my personal statement, I was actually asked about 2 sections, and I was asked about work experience I did here and also work experience I did abroad. And I only managed to talk about the one I did abroad, and I did from what I gather, I did pretty well on that station. And as much as I ran out of time, I did talk quite passionately about the thing I did abroad and what I gained out of it and what I learned and why I think it gave me the qualities to become a good doctor. So as much as your examiner will want to give you an open avenue to talk about things, sometimes don't feel like what you know really well. If you know that you can talk about one aspect quite well, you'll still do great. Don't feel like when you come out of it, oh, but they asked me about both, and I only talked about one. No, actually, if that one example tells us everything we need to know, that's great. We'll be like, oh, those are great qualities. Well done.
Mm-hmm. So thinking about some examples now to put what we've said into practice. So for example, taking something from your personal statement and elaborating on it. So the points on the left are a little snippet of an example, and then the points in green on the right are what would make a standout candidate to us. So just reading off the slide, I gained some work experience by shadowing on a vascular surgery ward, which I enjoyed and gained a lot from. I had the opportunity to work with an FY1. This showed me what life as a junior doctor is like, and I think I have the personal attributes that will allow me to excel in a career in medicine. Now, I can see what this person's trying to do. They're trying to say, what I've gained from this experience is that I now understand what my life would be like as a junior doctor. So, I've learned things from it. But this sort of reflection is really shallow. It's really shallow. So they're trying, but they're not getting into the depth that you would want from a reflection. So something, now I'm gonna just like spiel. So this is sort of paraphrased with some phrases, with some key phrases essentially. So saying something more along the lines of, during my time shadowing on the vascular surgery ward, I got the chance to be involved in a discussion about a patient who had an amputation for severe vessel disease. I saw what it meant for a patient, and that their care isn't actually about the immediate medical and surgical issues, but that actually a multidisciplinary team comes together to think about the long-term consequences and the rehabilitation for someone who's had to undergo some quite severe medical or surgical issue. And this has taught me two things. So being specific and saying that, this has taught me X and Y and what that shows. So firstly, that making a patient better is often about more than the immediate medical aspect, and that it actually requires a really vast range of experiences and knowledge bases to think holistically about patient care. So thinking about all aspects of their care and their long-term rehabilitation. And the second thing, I was struck with the different skill sets on offer. So for example, occupational therapists, their knowledge base is really distinct from the medical team, but it's just as essential in maintaining the patient's quality of life as they prepare for rehabilitation when that patient goes home. So it's being specific, showing that you've learned something, and then the way to take that even further is how you would apply what you've learned. So you would say that, if I was a junior doctor or if I was a medical student, this allows me, or this experience has allowed me to appreciate that occupational therapists take this part of the patient's care, X part of the patient's care, and that their rehabilitation goals would be X, Y, Z. So it's just, thinking about those specific reflective points that we covered earlier on. I hope that makes sense to everyone. So another example is, this is for a patient simulated station. So you go into a simulated patient station and they say, this is Barry, Barry's 50 and he needs to have a CT scan, but he doesn't want to have it. Persuade him to have a CT scan. So you go into the station, Barry's really resistant and he just he's refusing to have this CT scan. And one of the pitfalls is that you've obviously been given a brief that says persuade Barry to have a CT scan. And so you try and be overly persuasive. And, you've got it in your head that the most important thing here is to come out of that station and for Barry to have come round and accept the scan. So people will end up turning to phrases like, the scan's going to benefit you because it will inform us, if something's wrong, then we can treat you. You might not get better if you don't have the scan. If you need treatment, then not having the scan is going to delay that treatment, and that obviously might have implications down the line. And that comes across as being sort of coercive, overly persuasive, like an authoritarian approach, which is not the approach that we want to have as doctors. So in that sort of scenario, if you come out of that station and you haven't managed to persuade that patient, don't take it as a negative outcome from that station. Quite often they will push you and they will push you and they will push you, and you might not achieve the outcome that you're set out in your brief. So standout candidates to us initially clarify what the problem would be. So using terms like, I understand this, is that correct? So you make sure from the offset that you're on the same page, exploring their concerns, and thinking about how you can help them overcome those concerns. And also thinking about patient choice. You've been set the brief of the CT scan, and trying to persuade him to have it, but actually it's his body, it's his treatment. So thinking about, we're not going to expect you to know all the different imaging modalities for finding X lump or whatever, but just being aware that there might be alternatives. Okay. So you can use that get out clause of, there might be an alternative, which I can discuss with my senior. Your senior's not there, but so long as you can show us that you're thinking that actually there might be patient choice here. And obviously listening is the most important thing. This is, again, a tricky one, because sometimes simulated patients will talk at you quite a lot. And if you listen intently, you might end up listening for 8 minutes and you might not get a word in edgeways. So listening is really important, but taking those opportunities where you can jump in and show us how good you are is great, but making sure that you listen, you don't talk over the patient. One of the things that sometimes is nice is if you feel like you're coming to the end of a station, and maybe you've got an extra 30 seconds to fill, is thinking about, okay, you've asked them if they've got any questions or concerns at the end. They say no, I think everything's covered. You can say, well, if you think about any other questions, or if you think about anything else that you'd like to ask the team, write them down and we can come back to them later, because that's sort of showing that you're thinking about not just the immediate station, but you're thinking about sort of addressing patient concerns later on down the line, which you're obviously not going to get to, but might be a little bit of a cherry on the cake at the end.
So moving on to an example of a prioritization station. So, I'm just going to read the question out, because you are a junior doctor on a medical ward and are due to finish your shift in half an hour. You have exciting dinner plans which have been booked for weeks and are in a hurry to get away, but you have some jobs to finish. And you have to outline the order in which you would complete the following tasks. Telephone discussion with a family member who requested to speak to you about their relative. They've rung the ward multiple times. The pharmacy bleep you about a medication error which needs changing. Email the rota coordinator with your study leave requests. The deadline is today. Review a patient whose nurse tells you is complaining of chest pain, and replace a cannula drip that has stopped working. These are quite specific to a medical situation.
Sorry, my fault.
But they could be based around simple things, like you might be asked to prioritize how you'd react in a situation where, for instance, someone's collapsed in a shopping mall, and first option would be to ring an ambulance and check on the person who's collapsed, and the last option would be to just continue on with your grocery shopping and someone else will sort it out. That's a very plain example, but moving on and thinking about sort of the themes we've talked about today, remember how safety is one of the main things we assess, and I think if one thing that's carried forward throughout medical school as well. Patient safety always comes first. And in a sense, safety can translate to, being just, practicing and having good ethical, moral principles generally as well. In that scenario, so in the case of if someone collapsed in a shopping mall and, you were concerned, you would go and check on them and at least ring an ambulance. You wouldn't just continue with your shopping. But in this situation, you would want to first sort of review the patient with chest pain. they're an active issue, yes, you're due to finish, but that person is most at risk and it can be quite serious. And then move on to sort of talking about pharmacy medication errors, replacing the cannula because the person's not going to get their drip in, and then discussing with family members as well. It's always something you can ask another colleague of yours to do who's going to change over on your job, of course, but you would want to get that in. And the last thing is, you know, study leave requests, something you can always do while you're not at home, not at work. And the thing is that that's, let's say, an example choice someone would make. That's maybe the ideal choices, but I'd say that what really makes you stand out if you don't choose exactly those priorities is what is your justification behind them, and are you able to tell us what you know, from a critical point of view, why do you think maybe it would be important to fix the medication error? Is it a time thing? Is it something that you think you could do much quicker? Or, you know, do you feel that is safety-wise more at risk? But the examiner in this situation will really try and challenge you and try and see what exactly is your reasoning. And they might try and allude you back to, you know, what do you think is, who's at risk at more, you know, do you feel like the chest pain or the medication error is quite a big issue? And if you're able to weigh out your argument and, you know, really sell it and tell us how you're thinking, you're doing well in the station. But if you blindly just know that, okay, yeah, you've chosen the right things and you leave it there, but you don't tell us why you chose those things in that order. So you could choose absolutely the order that we've listed, but you don't tell me why you've chosen chest pain first and why you put study leave requests last, then I'd be a bit lost, you know, because as examiners, the one thing you have to realize is that we can't assume what the candidates think. And when we mark the stations, we're asked to explore what you've told us. So if you simply listed off what you're going to do, but not explain to us in this situation why you've chosen what you've chosen, you're not going to get those particular marks that we're looking for in our crib sheet. So that's kind of what we're alluding to, is that actually, as much as in this scenario, there's a tendency to think, okay, as well as I know what's right and I know why it's right, tell us why it's right so that we can give you those marks, because we can see you demonstrating why you think something is right and what sort of qualities you're demonstrating as a result of it. Oh, this person can balance an argument, can actually, you know what's right and what's wrong, talks about some ethical principles here, talks about patient safety, and those are all good qualities that we're looking for. And yeah.
I think one of the things in the example as well is that they're in this particular example is that they're trying to bring in some experience from before. So sort of saying, you know, I know that family discussions can take an awful lot longer from having worked in a care home or from bringing in some sort of other work experience, is a good thing to try and do, to sort of say, you know, like I know a little bit about this, and to try and yeah, bring your own personal experience into it. Again, this is a little bit shallow in terms of saying, well, I know that family discussions can take a long period of time, so I don't think we should do it because it's going to take more than the half an hour that I've been given. But showing the interviewer that you kind of understand some of the basics behind sort of the options that you've been given, and taking us through, you know, it's the processing. I think if you were to say, right, I'm going to do it in the order 5, 2, 3, 1, 4, whatever, and I'm doing X, Y, Z, and it takes you 2 minutes out of an 8-minute station, that leaves you with 6 minutes of probing questions from your interviewer. And they will probe and they will ask you sometimes potentially difficult questions, whereas if you take your time and you do your explanation, then you get less probing questions from your interviewer as well. So taking the time to really go through your justification will avoid us asking some difficult questions, because if we don't understand your justification, we might throw it back to you and say, well, you know, do you not think that X is more important because of this? Or why would you say this? Have you not thought about X? so it can leave you open to being in the firing line a bit. So use your time wisely, I think, again, is another handy tip. So I think we're sort of coming to the end of the main bulk of the talk. So we just obviously want you to remember that we know you're nervous, we do, and we appreciate that you're nervous. A lot of your interviewers will potentially be medical students or have been in your place. Sometimes there'll be consultants that have been in your place, 30 years ago, but still they'll understand the anxiety that comes with having a medical school interview. So it's their turn to show some empathy, and they will show some empathy, even if it's behind a stony face. Everyone's going to have good and bad times with their interviews. We're not going to penalise you necessarily for that. But what we want to see is someone who's really passionate about entering into this career, because it is a really great career. And you have to work really hard. So we want to see someone that has passion for it and has the skills to transform them into someone that we'd want to work with. That's essentially, what we're going to look for in I'm not going to say, do I necessarily want to work with this person right now, but do they have the qualities for evolving into a doctor that would make a really good team player and someone that I would want to work with, in 15 years time. So be yourself, smile. It is, I think a lot of the interviews this year are online, doing interactive Zoom MMIs or panel interviews or whatever. So you can smile, you won't necessarily be in a mask. We want to see friendly, approachable candidates. So yeah, Abbas, did you have any final words? Final words of encouragement?
I'd say this: show us the best of yourself on the day. Don't also beat yourself up, as I said, about each station, and try and just demonstrate who you truly are and why you really want to be in, why you want to get into med school, why you want to be a doctor, and remember, like Thea's saying, we've all been there. All the people on your interview day know that you're nervous, and they will empathize with your situation. And as much as you might be in a station where in the firing line and you're being asked loads of questions, it's only because we want you to really show us the qualities that make you stand out. So try and just keep your composure is what I'll say. And guys, all the best as well. And yeah, smile. Honestly, it really changes and lifts the mood of the examiner as well.
But yeah, so I think we've got potentially some questions. I can't see the Q&A function, but I think Anna is going to take charge of question time.
Definitely, we have many questions, so thank you so much everyone for engaging as much as you did, and thank you Abbas and Thea for such a lovely presentation. So most questions I was able to answer them with the help of Charms live as well, but we have still a selection of questions that I think would be really good if answered live. So I think the first one that I really liked, and we should get out of the way because this is really important. Are there any common mistakes that candidate makes that might lead to them being rejected after an interview straight away?
Ooh, that's a difficult question, because obviously, it depends on the scenario, the setting of the interview, because for an MMI interview, the answer is no, because you could say something in one station that someone would go, oh God, no, I really don't like this candidate. But that's one station of maybe 10. So that would not lead you to being rejected straight away. It's not specific to any particular medical school, but I've not come across any scenarios where, a candidate will be given, for example, like a red card or a warning or anything that would say that we absolutely can't take this candidate. That's not something that I'm aware of. But there would be responses to questions, for example, if we thought it made someone unsafe, that we would, think that you might not be as suitable as an entrance or as a candidate for medical school. But I can't think of anything off the top of my head that would be like, no, you absolutely, that's a done response. I think you've got opportunities to redeem yourself.
I think that's again why the MMI is the way it is that, you know, we test you in different scenarios, and ultimately there is a global score, and there's also, from an examiner's perspective, I think you do generally have a bit where you are also allowed to sort of say if there's anything in particular that concerned you, but that would be across multiple stations, as Thea said. So one examiner's opinion might not be translated over across the other stations. So it will be really critically looked at. So you shouldn't feel that there is something about yourself or something you might say in particular that you have to, you know, prepare in a certain way. Or that's generally how it's standardized, and that's the beauty of being in that setup rather than a panel, at least.
Well, even in a sort of panel interview scenario, you have sometimes 3 or 4 people, and so what might be a response to a question that one person doesn't like doesn't necessarily mean that all the other people in that panel aren't going to like it as well. I think, okay, yes, there might be something that everyone might say, oh, actually, I don't think that was an appropriate response to that question. But I think it would be very unlikely that you would say one thing in your interview that would give you a strike through your name. Okay, they'll be looking at you on a global in a global way, and they'll be assessing lots of different things. And just because you don't hit all of the marks, or you say something that wouldn't necessarily be an ideal answer, wouldn't, you know, strike your name off the list.
Thank you for your answer, and I completely agree. But of course, please, guys, refrain from saying anything racist or discriminatory, because of course, that would be quite a red flag. But at the same time, I trust you all to be quite empathic humans if you want to study medicine. Hopefully, you don't have any of these characteristics at all. But thank you so much, guys, for your answer. There's some other good ones. For example, how do interviewers assess honesty?
This is a tricky question, because generally it comes down to gut instinct, doesn't it? I guess, because we can't tell if you're, you know, an Oscar-winning actor and you're feeding us a load of lies, then, you know, it's going to be up to us to decide whether we think you're right or wrong in terms of, you know, being honest about the things that you're saying. In terms of like a specific station briefing about testing honesty, I guess that could be tested in, for example, one of the prioritization or escalation stations. If one of the responses has a disingenuous or a dishonest element to a response, that would be a way that we would test if someone was honest or not. So maybe going back to the topic that Abbas was saying about, you know, if a friend's, I think it was, did you say it was a friend's cheated on a test or something?
Yeah.
Then that, again, one of the, or a couple of the responses could have dishonest elements to the answer, and that would be a way that you would test honesty, I think.
I.e. just not choosing a response where like you just don't, I guess tell on your friend is a harsh word, but trying to address the problem there. The problem is the cheating, isn't it? The other elements that I think could catch out the fact that you could be dishonest is, yes, like you said, if you're a brilliant actor, you could try and trick us through. But there are things we look for on crib sheets and our mark sheets that look at specific aspects of an honest answer. When you talk about your experiences, you know, you could tell me you did this award-winning research project that you could completely just make up on the day. But if you can't tell me what sort of skills you gathered from it, and you know, you just tell me the title of your project and that's pretty much it, and it won this award, I'm not really going to be that impressed by the answer just because of its level of achievement. So, and I'll probably not doubt that you've done it, but like, I guess you lean towards, has this person actually, you know, done this project? Are they able to tell me a little bit more about it? So we will prod you where we think we need to prod you if you've not given us a complete answer, and it might come off as dishonest. But those are the methods in place, I guess, because it is quite difficult to assess that.
Sounds good. Thank you very much. And to all the attendees that are sending us so many questions, we actually have loads of them. So sorry if we don't get to yours. Please feel free to email us at events@in2medschool.com if we don't get to your question. So next up, this is good. Does your work experience always need to apply to healthcare?
No, no, it doesn't. It doesn't.
No.
Especially in these times, we understand, and your interviewers are going to understand, that COVID has ruined a lot of work experience in hospital. Loads of people have been turned down for having in hospital or in GP practice and community placements this year, because obviously it's not safe for you or patients. And obviously we'll take that into account. We know that loads of people this year aren't going to be able to get the in-house experience, and a way, you can show the attributes that we've discussed, maybe, not necessarily communication with patients, but you can extrapolate those skills to, sports teams, to societies in school. You can think about, it really doesn't have to be specific healthcare things. It's just so, and I think obviously there's going to be a lot more leniency this year with the COVID situation, but you can extrapolate from lots of different scenarios.
I can give an example. I remember someone speak, which I thought was really good, speaking about looking after their siblings at home, because they talked about sort of being the eldest and sort of also talking about leadership skills in that sense, and sort of learning how to be independent, and kind of how they learn to grow from that aspect of giving care, in a sense. It wasn't healthcare related at all, but it was pretty impressive in my eyes, at least, because I was like, oh, actually they've told me what they've learned from being the eldest in the family. Mm-hmm. Something very simple. It could even be you do things as the youngest in the family, so really speaking, the room is open to anything in that sense. Don't worry about medical experience only.
It sounds really, really good. And I remember that I did some veterinary work experience, as well as some tissue work experience alongside some medical school things. And you could definitely talk about those anyway. But guys, if you're afraid of not having gotten any work experience because of COVID, please go on our Instagram page, where we recently put out a post with 4 free virtual work experiences opportunities that you guys can sign up for. And you can definitely take advantage of those if yours has been cancelled due to COVID, or if just you want to do something more. Next. Oh, there are so many of them actually. Okay. Okay, this is good, and it's come up quite a few times. People are asking what would be a good question to ask the interviewer to show that they're interested in medical school, etc. And I think this kind of links with if I have any free time, do I just waffle and waffle and waffle, or do I keep quiet? So yeah, I think that's something that should be said. Go for it, guys.
That has made me laugh, because I remember one of my stations in my medical school interview where I had this scenario where it was a station, and I'd finished and we still had sort of a minute and a half's time. And I was just, I was like, oh, I'm gonna have some small talks and just some chats. And so I asked my interviewer, I was like, oh, so what year are you in medical school? And she burst out laughing. She said, dear, I'm 42 and I'm part of the admin team. And we were just laughing, giggling away about the fact that I thought that she was one of the med students, but actually she was one of the admin team secretaries. And it's good, just even if it's not necessarily asking a very specific very well thought out question to your interviewers, just showing us that you're people, you know, that you're there and you're happy to interact, and that you're a personable person is also what we're looking for as well. But I think if you want to, you know, if small talk isn't your bag, but if you want to think about a specific question to ask, then I think that ties in nicely to thinking about a particular element of the course that maybe you've looked at, and that you want to know a little bit more. But obviously bear in mind that the people that you're speaking to might not necessarily know the curriculum inside out. So it's a tricky one. I think, I don't know, Abbas, do you have any questions that you would want to hear as an interviewer? I quite like a small chat, small talk.
Yeah, I'm the same. I like to make the person feel very comfortable before they move on to the next station. And I guess I don't know about other MMIs and how much examiners are allowed to sort of chit chat. I know, at least from a Leeds perspective, we're not discouraged in a sense of just being personal a little bit and saying, you know, we're doctors or we're medical students or we're, you know, members of staff or etc., and being able to talk about those aspects if we feel we want to. I remember some interviewees have asked me, you know, how are you finding the course? Because I was a medical student when I did mine, and I thought that was okay to talk about, you know, because they were just maybe interested and just wanted to feel calm. And yeah, those are simple things you can ask, or I wouldn't prod on to asking about sort of related to the station. That definitely don't do that. Just keep clear of that. Yeah, I guess it really depends on who's the person in the room and how much you feel comfortable. But there isn't a specific thing that you can ask that will make you stand out, is what I'd say in particular, because it doesn't change the station. It just maybe changes our impression of just who you are as a person. Yeah.
No, I think it sounds really, really good. And it's good to ask like personal questions like how are you finding the course, etc., particularly if you're being interviewed by a medical student. However, if you ask something like, so is this medical school traditional or integrated, or do you use problem-based learning, etc., you might come across as somebody that hasn't really done the research about the place where they are applying to. So of course, if it's something that you can find on the internet, just Googling the med school, then maybe that doesn't give off the best impression, or at least that's what I was told when I did my interview prep. Next up, people have asked what to do when they don't really know how to answer a question, or when they haven't understood a question, and also what they could do if this is the case when their interviews are being recorded instead of them having an interview live. Because apparently this year some medical schools have sent out an email saying that their interview will be recorded, but they might not see the interviewer live.
Sorry,
so,
I need to clarify that. So do you mean that they're going to be sent a recording of an interviewer rather than it being a live interaction?
yeah, so they were apparently told that they would receive a question and they have to record themselves answering the question. So as they would be lacking the one-on-one interaction with their interviewer, they are asking what they could do if they don't get the question. And another similar question was just if I'm having a one-on-one chat with an interviewer and I don't really get what they're asking me, how could I go about asking them to clarify?
I think quite a gentle, so this is talking about the one-on-one interaction with an interviewer rather than the recording thing. I'll have to have a think about the recording thing because I've not come across that yet. But a gentle way to do it if you've got an interviewer is to, I want to say ask the question back to them, but it's not, it's just kind of clarifying that you've got the question. So they'll ask you something, and if you can't quite process it, you'll say, I think what you're asking me is X. Is that correct, or have I got the wrong end of the stick? And if you've got the wrong end of the stick, then they can rephrase it. That's something that I've done before, where rather than sort of jumping into an answer that you think it is, you clarifying the question with me is not going to, it's not going to show that you're not, that you're not quick enough or you're not smart enough. It's just ensuring that you're going to give me an answer that's going to get you points. So if you sort of say the question back to them, saying in a slightly different way, say, okay, I think what you're asking me is this, is that right? And then they go, oh, no, I meant it like this. And then they'll rephrase the question for you. I think that's probably quite a good way of getting clarification. For the recorded one, I don't really know how you would, if you don't understand it, then I think it's probably a bad recording of a question. If it's going to be a question that they're going to send out to multiple people, they're going to be sending out to hundreds of people, then it should be really clear. I would hope that it will be really clear. But if it's not something that's clear, then maybe you could sort of say at the start of your recording, I think the question that you're asking is this is my response. So, then they can understand that maybe you haven't quite caught you haven't quite got the right end of it. But that doesn't obviously give you a chance to modify your response. But I'm not sure how you get around that really with a recorded question.
And I guess in that situation, in terms of the recorded station or recorded interviewer, you kind of have to just, like Thea said, say, this is what I understand you've asked, and then give your answer. Definitely give your answer to the full ability that you want to. And hopefully they will be moderating everything anyway. Well, I hope that the medical school does that, because that ensures some level of equality across everyone who's been interviewed. And like they said, they will try and make the questions hopefully very clear if they're very confident in doing recorded interviewers. But if it's something that's really worrying you, you could always email and say, this is something that's come up for me as a concern, because this is a different way of interviewing. Could I ask, as the interview panel, do you recognize that there might be a situation where I might not understand the question, or candidates might not understand the question? What should we do in that scenario? They might have a fail-safe, or they might have a way for you to sort of alert them to the fact that you're not understanding a question, or there might be a moderator on while you're watching the recording who might be able to answer your questions, hopefully. So just for the sake of easing your mind about it, just maybe consider emailing the medical school who's given you the interview and just say, this is something that's come up as a concern for myself. If they don't reply, which I hope they really do, go about it the way I would say the best way to go about it is the way we've suggested, as saying that this is how I understood the question, this is my response. Hope that helps.
No, I think it's really, really good. It's helped, I hope. And if not, guys, just get in touch with us via email and we can try to give you some further guidance. I think another important question that has come through in different forms multiple times has been does mentioning the details of a patient story or talking about one of your family members count as breaking confidentiality? And from what I've learned, as long as you don't mention any identifiable characteristics as their name and surname, their date of birth, or NHS number, if you know that by heart, then you should not be breaking any confidentiality. But this is just my third year medical student knowledge. So please, Abbas and Thea, shed some light onto this.
I think that's spot on. Yeah, just non-identifiable details. If you just simply say a patient I saw and keep it that simple, and just say what you learned from it. Don't say their name, don't say their date of birth, as you said, or NHS number, or any sort of characteristics that would make them identifiable. If it's a really strong element of the story, and you feel like you won't be able to not, like it's very unique, in not any sense, I would think you'd be able to anonymize it. Then maybe steer away from that story if you think it's going to break confidentiality or it'll be too specific to a family member, and I guess just that's the core thing to remember. We wouldn't be expecting that you would tell us the name or the date of birth or the NHS number. you've covered it quite well, Anna.
All of those ethics classes I attend must somehow pay off. Next, oh my God, you guys have so many questions. Okay, so yeah, would it be good to talk about how you may care for a family member if asked when you've showed compassion and empathy? And Abbas has already answered this, saying that somebody that was taking care of their siblings seemed quite empathic and altruistic to him, and I definitely agree. Oh, this is a good one. Do fillers like this is my acting count as bad communication skills?
If you can avoid it, I would. I understand that some people who are really nervous fill silences with it happens, it does happen. And I remember looking back at my intercalation dissertation presentation video, because they recorded all of us, and I said about 6,000 times in 45 minutes and used my hands, like ridiculous hand expressions. And looking back at it, it's distracting. It is distracting. And it obviously fills in valuable time that you could be telling us really important information rather than erring on eyeing. But some people can't help it. And if you're nervous, those things, those sort of like tics tend to come out and pronounce themselves more. If you can practice, there you go, I've just done it now. If you can practice it, if you can practice responses and try to avoid using filler words, then that's great. If it's every other word in your interview, we're going to notice. Yeah, I think that's probably what I would say.
And noticing will distract us from what you're actually trying to tell us.
Yeah.
Because we will notice it so frequently that we won't actually listen to the content you're giving sometimes, because that's just, I guess it's just human tendency to do that. There you go. I've done it too. And there we go again. So just try and avoid it if you can.
So much. Next up, how would you approach discussions on controversial topics? So Thea and Abbas have said that if this is about ethics, you should use the pillars of ethics. And we have kind of answered this in the previous webinars we've done for MMIs and panels, where we kind of approach some interview types of stations. So maybe you can look that up. Next up, in interviews, are there considerations for contextual applicants, or is every candidate assessed in the same way?
Sorry, I think it might be my internet connection, but you broke mid-sentence. Do you mind just repeating that?
Oh, no, it's fine. So I said, basically they're asking if every candidate is assessed following the same type of guidance, or if there's any difference with contextual applicants. I guess if they're part of WAMs, etc.
Not that I'm aware of in the interviews that I've done. Everyone gets the same crib sheet. Everyone is assessed in the same way. I've not been, no one's come and whispered in my ear beforehand, like, oh, this applicant, blah, 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 blah. It's, you're all I don't want to say you're all the same to us, but I don't think that there's anything like that.
I agree. I think it's designed to accommodate for all types of applicants as well. To put things in context, I came all the way from Kenya for my MMI. And I didn't do it differently. I remember we had a mixture of a cohort. I was an international student then, so the interview was the same for everyone. And there were no sort of different, I think, accommodations. And yeah.
No, I think that makes a lot of sense. And as far as I'm aware, WAMS candidates, like widening access to medical school candidates, either get their offer lowered or they are a bit more lenient with their GCSE grades and UK CAT BMAT grades. But of course, this depends from med school to med school. So if we don't really know where you're applying, unfortunately, we cannot tell you more. And I think we're going to take one last question, just because it's 4:30 almost. And let's go for, Okay, how would you answer in a non-stereotypical manner? Why would you want to study at this university and why medicine?
Oh, we're not going to do your question. We're not going to do your responses for you. I would suggest thinking about, I'm not going to go into the why medicine thing because it's individual. We want you to be honest. I want you to be honest. So tell us why you want to do medicine. I don't want to see you regurgitating some answer because you think it's really interesting. Like, I don't care if someone has got this really rogue reason why they want to do medicine and it's going to be interesting. I just want people to be genuine in their response. You know why you want to do medicine, so tell us. If it's stereotypical, it's stereotypical, and that's fine, so long as you're honest and you're genuine about the reason why you want to go into medicine, I think is what I would say. In terms about the specificity to the university or the course, just reading everything online, there's quite a lot of information about curriculums and sort of how the years are structured on medical schools' websites. But another potentially, I don't know, Anna and Joms might correct me on this, but if we've got most of the medical schools in the UK, we've got representatives in In2MedSchool, and potentially what you might be able to do is reach out to those representatives that we've got and say, look, I'm really interested in applying to this medical school. Is there anything that's going on that's topical at the moment? Is there any research interests that are really specific to the hospital that's attached to that medical school? You know, I know you don't necessarily have contacts at medical school, and we get that, but that's sort of what we're here for as In2MedSchool. We've got links at places that you want to be applying to. So potentially you can think about reaching out to some of our In2MedSchool regional leads if you want to find out a little bit more about courses specifics that, you know, might stand you in good stead, or get some like insider knowledge or information about specific research projects or interests that are specific to that medical school. Might be a good first point.
And I guess it's why you want to be a doctor. There's no golden answer there. It's why you want to be a doctor, isn't it? So tell us something personal that's happened for yourself that you think would be a great. I went about it like by just giving a story and then saying how that led me on to pursuing a career in medicine. And yes, that's stereotypical. Everyone's going to do that. But what makes your story about yourself, and what makes those qualities about yourself make you a good candidate to be a doctor ultimately, and why you chose it as a profession is what's important. And it's like Thea said, we can't give you a golden answer or write out a script for you to say. But if you know in yourself what made you choose medicine, then you've got the answer right there. And that's all you have to go with. We're not looking for anything. We're not looking for a wow factor. We're looking for what makes you and suitable for this profession.
Thank you so much. I really, really agree. And I think that you guys should also look at the MMI and panel webinars we've done, because we have answered some of these questions you guys have there with a like average answer and a bad answer, just so you would kind of understand like what mistakes not to make. But also, as Thea explained, we do have In2MedSchool mentors in almost any university in the UK. And even if you're assigned to a mentor that is close to your region, so for example, you're from Essex and you would be assigned to my medical school, we can definitely get you in touch with the medical student from the university you're applying to, and they will be able to give you some guidance. So if we can just put up our last slide with our Google review and our feedback form. So Google reviews really, really help us because we do all of this on a voluntary basis. And it's just nice to know if you guys are enjoying the different activities that we put through, whereas the post-webinar evaluation form is webinar specific and is just so Abbas and Thea know what they did well and what they can improve for next time. Upon completion of this, you will receive an automated email with your certificate, as well as a Google Drive link where in a few days you will find the recording of this webinar and the slides. Please get in touch with us if you have any questions at all at events@in2medschool.com. And thank you so much for engaging. Sorry guys, we couldn't get to all of your questions. We've answered 60 and we have 16 to go to still, but unfortunately we've run out of time. So please feel free to get in touch with us if you need anything at all. And thank you to our speakers as well for joining us today.
Thanks everyone for attending.
Thank you guys, all the best.
Thank you guys, have a good night.